46-year-old female patient was brought in by ambulance unconscious. Family says patient had been suffering from fever, dizziness, and confusion and tremors for a few days before collapsing at home. Upon further assessment, a 6.4 centimeter deep necrotic laceration was found 2 centimeters distal to the right popliteal, extending laterally toward the superior sural region. Necrotic tissue also extends from the right popliteal region proximately to the midfemoral and distally to the tarsal of the right inferior extremity. Hepatic and pulmonary failure due to sepsis has been confirmed. Treatment will include excision of necrotic tissue, which will include the right inferior appendicular distal to the superior femoral. Surgery will be followed with IV administration of saline solution, corticosteroids, and antibiotics in the left antebrachial region. What? That was insane. Let's break this down. Today we're going to be working on directional terminology along with our body regions, just so we can interpret what that crazy chart had to say about that patient. So, I'm going to use a simplified version here. Let's begin with our anterior and posterior. Anything that is closer to the front of the body is considered the anterior. Anything on the back is the posterior. So if I said my nose and the back of my head, or the nasal and occipital, my nasal would be considered anterior to my occipital. Okay? Or I could also say my scapular is posterior to my clavicle. Okay? The next set of terms to use is superior, anything that's higher up, and inferior, anything that's lower. So, for instance, my mental is superior to my cervical, okay? Or my nasal is inferior to my frontal, okay? So we're talking about relationships. Okay? The next set I would like to work on would be our lateral and medial, okay? So lateral and medial. So lateral is anything closer to the side of your body, and medial is anything closer to the center of your body. Let's label this on our diagram. So this would be medial, and then lateral. Lateral. Okay. So some examples of that might be, if I was talking about my hands, my thumb in the anatomical position, my thumb would be considered lateral to my digits. Okay? And my sternum would be considered medial to my ribs. Okay? My clavicle would also be medial to my acromial, or my shoulder. My shoulders would be lateral to my sternum. Another one, which sometimes is a little confusing, is intermediate. So this is something where it's not the most lateral, it's not the most medial, but it's somewhere in between. So for instance, I might say my lungs are intermediate in between my heart and my arms, or my ribs. Okay? Another one to consider would be distal and proximal. Now, be careful with this one. This is one that you only use when you're referring to your appendicular, or your arms and your legs, your appendages. So, We use proximal to refer to anything that's closer to the torso, right, or the trunk of your body, your axial. Okay. And anything further away along your arms and legs would be considered distal. So my olecranon would be considered proximal to my carpal, but my olecranon would be considered distal to my acromial, or my shoulder. The last set to consider is superficial and deep. Okay? So anything that's superficial is anything closer to the surface, sort of like our skin is the most superficial. And anything deep, this is where we're going into our body. So our guts, basically, right? So our heart would be considered deep to our ribs, and our skin would be considered superficial to your muscles. And that's how you decode all of that crazy medical terminology. Thanks for watching.